is the kissing disease. It's very hard to shake it, but you get it with ease. So if you're really sweet 16 and never been kissed, how come you're on the mononucleosis list? Mononucleosis won't make you very sick. So baby, get your Blue Cross card and kiss me quick.
Welcome to the pathophysiology of mononucleosis. So mononucleosis is actually caused by the human herpes virus type 4, which is called the Epstein-Barr virus, EBV for short. It comes through contact with saliva, and from there it first hits the epithelial cells in the mouth, and then it hits the B cells and the T cells right around the tonsil region. So this is in the laryngopharynx or nasopharynx area. From there it replicates and infects the B lymphocytes in that area, where it travels through the rest of the body through the reticular endothelial system. And this causes a cellular and humoral response. One of those responses is that the T helper cells, the CD8 plus T helper cells, are trying to fight the virus. So to do that, they develop atypical lymphocytes. And from there, after it replicates throughout the body, it remains there for life actually. And intermittently, they'll have asymptomatic shedding, so it kind of will lie dormant and then go through shedding periods as well. And that is going to be coming from the cervix or else the oropharynx. And for detection, actually only about 15 to 25% of positive mononucleosis virus patients are detected. So here you can see the normal cells being infected from the EBV. And this is also just another little diagram of how it enters through. So you can see it comes through the droplets, comes through direct contact with saliva or really any bodily fluid. And it goes through the body, and that is how then the whole cellular and humoral responses take place. For detection, actually only about 15 to 25% of EBV seropositives are caught. So a lot of people will go through this infection not even realizing that they have it. They just feel all the symptoms and side effects.
Let's talk about the etiology of mononucleosis. Mononucleosis is caused by the Epstein-Barr virus, which is also known as the human herpes virus 4. Diagnosis of mononucleosis follows a several-step process. The first process is an initial exam performed by a primary care physician. Following the exam, a complete blood count is taken. If results show an increased number of white blood cells in the blood of the patient, a monospot test is performed. If the monospot test comes back positive, an EBV antibody test is performed to evaluate the number of antibodies and the kind of antibodies in the blood serum. If this test comes back positive, a positive diagnosis of mononucleosis is confirmed.
So, today we are going to be talking about the clinical manifestations of mononucleosis. So there are a lot of manifestations that you can have, but they really vary between people in like the severity. And there's so many different types of signs and symptoms you can have that you never really know what you're gonna get. So, sore throat. I'm sure all of us have had a sore throat in our life, so we all know what this feels like. Dysphagia, difficulty swallowing, swollen lymph nodes. This often occurs in the tonsils and in the axillary region. Tonsillitis, inflammation of the tonsils. Fatigue. This is when you feel really tired, and this is very common with mono. So a lot of times when teenagers have this, their parents don't know, because as teenagers you sleep a lot. So a lot of times it goes undiagnosed. Body aches, chills. Neither of these are fun. Nausea. Again, we've all had nausea. Fever and splenomegaly, which can be life-threatening. So a lot of times when you're diagnosed with splenomegaly, you are not allowed to play sports or honestly leave your house. That's all.
About time you showed up. Take your seats.
Welcome to Mononucleosis boot camp, baby nurses. You guys ready to learn how to avoid mono? Yeah, I thought so. You're already doing the first thing wrong. Give her her drink back. No sharing drinks. It's gonna be harder than I thought. All right, let's talk about the second thing. A little more obvious. You're doing it wrong again. No sharing chapstick. Anything that touches your mouth, touches another mouth, you're gonna spread the disease. Sorry. Do you guys have boyfriends? Thought so. Okay. No kissing. Gonna have to just deal with it. Either of you guys have a blood transfusion? Planning on getting one anytime soon? If you don't listen to my class, you will. All right. Either of you guys have a heart that isn't yours? Kidneys, livers? No? Good. Organ transplants, that's another big risk factor. Either of you guys immunocompromised? No? All right. Well, with immunocompromised, you can have a higher risk of symptoms with exposure to Epstein-Barr virus. You can also have a higher risk of reactions and second bout of mono with this second exposure. So, baby nurses, how do you feel about going into the big world and avoiding mono? Feeling up to the task? Ready? Did you just graduate from Mononucleosis boot camp? Yes, you did.
Hi, I'm Arcadia. I'm 20 years old and I'm a victim of mono.
Okay, so can you tell us a little bit about when you got mono and how you got it?
I got mono my junior year of high school on prom night.
Mm.
Not in the way you would think. I just shared a drink with my date, and actually we made a joke at the time that we probably shouldn't because he's been sick, and yeah, but we did it anyway. And the next morning, I woke up, and my lymph nodes were so swollen, like visibly from across the room. You could see their outlines, and I was dead tired, completely tired.
Okay, so how long did those symptoms last?
The lymph nodes didn't go down for probably like 4 days. Like they gradually went down, but until they were unnoticeable again, probably 4 to 6 days. And other symptoms, I was just tired all the time. I could not stay awake. I tried to go to school on Tuesday. I stayed home on Monday and I tried to go to school on Tuesday, and they literally sent me home. I had my counselor walk me around to all my classrooms and get me like signed out because I was falling asleep in every class I was in because I could not stay awake. But so I was really tired, and I just had no energy level, and like not even to like get up and eat or anything. So like I hardly ate, and it was a mess.
And you lost weight, right?
Yeah, I lost probably like 13 pounds.
Over the course of?
Probably about a week and a half or so.
Wow.
Yeah.
Okay, so any tips for other mono sufferers or any tips for prevention?
Yeah, I think that we take it too lightly sharing each other's drinks. Really can get ya. So probably don't do that. Yeah.
Sounds good. Thank you.
No problem.
Hey, Mary.
Hi.
Okay, so could you tell us about your experience with mono?
Sure. So I was 12 years old, and we had just moved from Germany to Colorado, and we moved into our new house, and I'm guessing I caught it from someone in the airport, and I couldn't breathe well at all. So that's how it started. I had trouble breathing, and I couldn't fall asleep at night because of that, so I had to sleep upright, sitting up. And then on top of that, I also had this really bad respiratory infection, so a super productive cough. I had a fever, and I wasn't allowed to go outside or to play or run around because my spleen was so enlarged. So I was miserable, and I was cooped up in my room all the time. And by the time it was over, about probably 2 weeks later, I was just exhausted. I probably lost 10 to 15 pounds, which is a lot for a 12-year-old. And then I slowly got better, and it went away. Now we're good.
Wow, Mary. Okay, so tell us about how you alleviated some of the symptoms. So you said you slowly got better. What were some things that you did to help?
So some big things were sleeping upright so that I could breathe, and also Colorado, the air is so dry, and I wasn't used to that, so I had a humidifier in my room, like right next to my bed, and my mom kept that thing full all the time. And then she also gave me just some typical cough and cold meds, and then when I went to the emergency room, the doctor prescribed me some meds.
Perfect. Okay, and our last question, Mary. How did having mono affect you emotionally and spiritually?
Okay, good question. Wow, it's very deep. So, emotionally, I was just really upset because I was young and I had just moved in to a new life, and I just wanted to explore and go be outside with my brother and go to school and everything, and I couldn't do that at all. And spiritually, again, it was just kind of sad. Kind of sad.
That is kind of sad. Well, great. Thank you, Mary, so much for sharing your experience with us.
Thank you.